Hey, Alihupa. I thought I would come back and I know it's been like a really long time since I did a video, but it's yeah, we've been moving and things happen, life happens, COVID happens. Oh my God, that is like the craziest thing. And you know, I don't think anybody saw it coming. Maybe people did. I don't know. I sure as hell didn't see it coming. It's crazy. In my lifetime, I never would have thought that a pandemic could have happened at like this day and age, which I guess is extremely naive to think that way. But with modern medicine and things of that nature, I would have never have thought that we could have succumbed to this. Um, but I'm sure that's just naive thinking because anything is possible when you have so many people in the world doing so many different things and so many different cultures and um, just it shit happens and it sucks and yeah. Anyways, that was my little rant. So today I wanted to talk about the healthcare system in Sweden from my perspective. I am an American. I've lived in Sweden for almost 3 years. And so I'm just going to talk a little bit about my perspective and what I've experienced here in Sweden with socialized healthcare and the differences I've noticed when I lived in the United States to coming here to Sweden. Um, I think it's an interesting topic for both sides. People who live in the United States and wonder how it works, and people who live here in Sweden and wonder how it works over there in the United States. Um, so yeah, I'll jump right into it. So I lived in the United States for 35, 35 years, I guess. And then I moved here to Sweden. Um, I might have my numbers off, but I moved here in 2018. It's now 2020, of course. Um, and I mean, I can give you a little bit of a different perspective because I have a disease. So therefore, I've been to the doctor a lot, probably more than a person who doesn't have a disease would go to the doctor. I have Crohn's colitis, so therefore I've gone to the doctor in the United States a lot, and I've been hospitalized, and I've gone to the doctor not as much here in Sweden because my Crohn's colitis is under control, which is thank God. Um, but I've went. I've also had a child here in Sweden, so I can talk a little bit about that as well. I did not have any children in America, but I did have here in Sweden. Um, so in the United States, we'll talk about the United States first. In the United States, you have to have insurance, försäkring as they call it here in Sweden. It is extremely important to not go completely broke, that you have insurance. Even if you have insurance, it can be very expensive. When you get a job in the United States, you can you apply for the insurance. It takes about 30 days. So say you get a job working in a factory, and you want to take a part of the healthcare insurance. It will be directly taken out of your paycheck. You can choose different plans. For example, there's like a high and a low. The low plan is like the basic plan. That's what I always took. You can go to this selection of doctors and they you get a referral from your primary doctor from the board central to go see another doctor. Say you hurt your back and or you need to have an MRI done or something like that. You can get a referral, which is referral called in Sweden? Remiss in Sweden. You would get that, and you would go to see that other doctor. That's the basic plan. It's the cheaper plan. That's the one I always took. The higher plan, which is more expensive, I didn't really see it to be necessary. It's basically, if you don't like this set of doctors, then you can pick any doctor, and you can go to that doctor. If you really want this guy, but he's not in your plan, you can go to him. Maybe you pay a little bit more. For me, I didn't think that it was anything that I needed. It wasn't necessary for me. So I always took the basic plan, and it was just me. You can also add your spouse. You have to be married. You cannot be a sambo. You have to be married. A sambo in Sweden is kind of like domestic partnership, where in the United States you have to be married in order to put that person on your insurance. So you can put your children on. You can put your husband or wife on. You can add your you can have the healthcare plan, the insurance for like doctors. There's a dental plan where you can also add your spouse and your children, and you pay for that out of your paycheck as well. It's directly taken out of your paycheck when you choose which plan. There's also a high and low. So the low is the basic. You go to these dentists, or there's a high, and then you don't have referrals, and you can pick anybody. I never picked the high. I always just used the basic because it was cheaper and it worked. There's also a vision plan as well for the eye doctor, where you can kind of like save a little bit of money when you go. You can go, that's just one plan. There's no high and low. I don't think there's a high and low. You can correct me if I'm wrong. But that one was pretty cheap. It was a couple dollars out of my paycheck, and I always chose that too because I wear glasses. I should be wearing them right now, but my son broke them. I need to get new ones. And that one is where you can go to like, kind of like here we have in Sweden, we have Specsavers. In America, we have other optical lens crafters and stuff like that. You can just go to them, say, this is my insurance, and you'll save a little bit of money on your eyeglasses. So that's kind of cool. And so I always chose that too. And I added my husband to that, and my husband was also added on my dental plan. He did not want the medical plan. I think he went with his work through that. Because, I mean, different companies offer different prices for their plans. So if you work for a really large company, maybe your plan will be a little bit cheaper than if you work for a smaller company. Your plan might be a little bit more expensive, maybe not as good. Like when I worked for Circle K in the United States, I chose the plan there, and it was crap for me. It was cheap. It was too cheap. It was expensive to go to the doctors. It wasn't worth it. Then when I worked for another company, a large company, a global company, that was a great insurance plan. And also with the different insurance plans, the company that you work for has the right to change the insurance plan. So of course they're going to go with the cheaper insurance for them as well. So therefore it kind of sucks in a way. Here in Sweden it's just one. In America it's many. So, for example, in America, your company could choose Blue Cross Blue Shield, which is an insurance company, and then your price might go up next year when you go to buy insurance through your company, or it may go down, or it may stay the same, and then maybe your doctors aren't in that plan, so you can't go to your doctor anymore. You need to choose the higher plan. It's like a fucking mess. So it's really nice when your company sticks with one insurance plan. Often, if you're there a long time, they can change. And that kind of sucks because then you have to go to your doctors and say, hey, do you take this insurance? Do you take Blue Cross Blue Shield? No, I don't take them. Okay, well then now I have to get the high plan, and I have to pay more insurance just to go to my doctor, or switch doctors and switch all of my paperwork over, and it's a big fucking mess if you have a disease, because then all of your shit has to be sent to another doctor, and that doctor's probably going to retest you because they want to see it their way, and they want their opinion, and they want to, do their own testing because they get money for that. So it's a big fucking mess. So I don't like it, and I know there's many people out there that don't like it as well. So it's really nice when your company just sticks to one fucking plan, one insurance company, and they don't change it. Unless, of course, your doctor takes multiple insurances, then you're good, of course. But, there's always that chance that your doctor says, no, I don't deal with that insurance company because I've, had problems with them in the past. Okay, well, then you have this whole freaking mess. Or they say, yeah, I take Blue Cross Blue Shield, no problem, just give me your new insurance information once you have it. Then it's okay. So it really depends. But it's a really big hassle. And once you have your insurance plan, I think I paid for my insurance, for just me, for medical, I think I paid $350 USD a month. So I got paid every 2 weeks, so they would take out like 150 out of my paycheck each time I got paid. And that's about 3,000 crowns a month I paid just for medical insurance. And then there's dental, and then there's health, which also comes out of your paycheck. So therefore, it can be stressful. It can be hard, and so there's that little portion of that. I could go into more. So now you work for a large company. You've bought the insurance, and now you have to go see the doctor. So you can call up your insurance company and say, look, I need a primary care doctor, vårdcentral, as they call it in Sweden. And they'll say, okay, here's the list of providers in your area that you can call around and see if they're accepting new patients. So you can call around to these different doctors and say, are you accepting new patients? And when will you be accepting them and whatnot. So say you get a doctor and you have an appointment and you're going to go see the doctor. Well, then there's a copay. Just like we also have a copay here in Sweden. When I go to the doctor, it's 200 crowns, which is $20. Here in Sweden, or in America, when you go to see the doctor, depending on your plan, it's usually around 25 USD, which is around 250 crowns. That's with the insurance. So that's relatively the same. So you go and you get just a basic checkup and everything's good. Generally, when you have a plan in the United States, or you work for a large company and you have a plan, your blood work is included, which you don't have to pay for, which is really nice. Same thing in Sweden. I don't pay for blood work here in Sweden either, so that's really nice. I mean, it comes out of the taxes. I can go into that in a different one. For me, having Crohn's colitis, I had many colonoscopies and endoscopies here in Sweden. I don't have to pay a copay for that. In the United States, I did have to pay a copay for that, and that was 250 USD, which is a little over 2,000 crowns when I would have them done. If you had a colonoscopy and an endoscopy, then it's over 5,000 crowns that you would have to pay. So it's a lot of money, and it's stressful when they say, okay, you have to have a colonoscopy done. You're like, oh my God, now I have to come up with 250 USD or 200 crowns or 2,000 crowns. I have to come up with that. When is it? You've got to prepare for it. Save for it or whatever if you don't have it. A lot of people in the United States work paycheck to paycheck, or they live paycheck to paycheck, so therefore it can be tight, and you have to save even just for that, because it's hard. Living with a disease, it's expensive. It sucks living with a disease, but it's also expensive. And then I'm gonna eat too. I'm hungry and I haven't eaten breakfast yet. And I'm able to make this video because my son went to school today, which is good for him because then he can meet his friends. And I get a little bit of time to make a video. So, in the United States, you have your medical plan that you've bought through your insurance company. You have to have, if you have to be, every time you go to the hospital, say you had I don't know. I went to the hospital a lot because I had pain for my Crohn's disease. So therefore I would go to the hospital if I was dehydrated and I needed fluids and or if I was in a lot of pain and they could check me out or whatever. Just to walk in the door to the hospital, that was 2,000 crowns. It could be more now, it could be 3,000 crowns. That you would either pay for while you're there or you would get a bill in the mail. If you had to have any work done, like say you had to have an x-ray or an MRI, then that separate person could bill you as well. So that's another bill that you would get in the mail. On top of the insurance that you're paying for that as well. I had a life-saving procedure operation when I was in 2010. I had to have parts of my colon removed and my parts of my intestines removed due to my disease. I was in the hospital for about 3.5 months. When I got the bill, it was 174,000 USD, which is over 1 million kroners. And because I had insurance, I think I had to pay like $800, and then I had a couple little guys, of course, this guy did this, so I had to pay him. This guy did that, so you had to pay him. This guy did this, so you had to pay him. Every time you went in and out of the hospital, you had to pay for that. So there was like these little bills that kept trickling in afterward. You don't just get one fucking bill, you get a whole bunch of little guys. When you think you're done, you're not. If you get into a car accident and you have to take an ambulance, that's a separate guy. So that guy's going to bill you, and that's about 10,000 crowns, 1,000 USD to go and to take an ambulance ride. Once you get to the hospital, that's a 2,000 crowns, $200 to walk in the door, of course, like I said before. Then if you have to have an x-ray done, because say you broke your shoulder or you think you might have broke your shoulder, but it's maybe just, dislocated or something, that's another bill, because that's a separate guy that did a separate thing. It's not just one thing. Like in Sweden, it's a collection. In America, it's, everybody's charging you separately. So therefore, it can be really hard and really expensive, and you never know where your bills are coming from, or when they're coming, or when they're stopping, or any of that stuff, because it just doesn't come at once. It kind of just trickles in, and it can be very, very stressful. So a lot of people in the United States will refrain from going to the doctor or going to the hospital because of the price, and that sucks. And maybe that's where a lot of this comes in with COVID and stuff, because people don't want to take off work. They don't want to go to the hospital because it costs so much money. Because every day that you're out of job, you're not getting paid. So therefore, you're losing money and you're paying somebody else, and you might not even be getting the treatment or what you want done. So it's expensive. So people don't want to take off work to go to the doctor. They just work while they're sick. Therefore, other people get sick. So that's a little bit about the United States. If you have any questions, just let me know in the below, and I can try to answer them for you if I haven't answered them already, or if you're confused, let me know too. Now we'll move on to Sweden. So I came to Sweden in 2018. I was currently on Crohn's medication, azathioprine. When I got here, I had blood work done. And they found out that I was on too high of a dose of azathioprine and my liver was starting to fail. So therefore, they immediately took me off. And I had told my doctor in the United States for over a year that I thought something was wrong. I didn't feel right. I just felt like there was something wrong with my body. And they kept saying, oh, no, you're fine, just keep taking your medicine. And then I get to Sweden and they're like, no, stop taking your medicine, it's killing you. Stop immediately. So I stopped it and I immediately started to feel better. And then they're like, let's go ahead and try it again for your Crohn's. We'll start off low. And I immediately started having problems again. So I told them, I said, I'm not taking the medication anymore. Basically, I'll risk it. And they said, well, your Crohn's seems to be under control. So if you have any problems, we have to figure something out and put you back on some medication. And I said, okay. That was 2018. I haven't taken medication since, and I feel okay, although I do adhere to like kind of like a vegan diet, which helps me out a lot. Anywho, so in Sweden, you pay roughly around 35% in taxes when you have a job. And with that, you can go to the doctor. You can go to school and different things like that. We can talk about school in another video. So going to the doctor, if you have to, when you first get registered with the Person number, which is like a social security number, you get like, this is your doctor. You get like a letter in the mail saying your doctor is here, and they kind of pick the closest one to your home or your like community or whatever. And therefore, that's who you would call if you have any problems. So say you need a checkup, or you want to go see a therapist, or you want to have blood work done or something like that. You call your vårdcentralen, which is the closest one that they assigned you to, and you tell them what you want done, and they'll usually call you back or let you know what they can do on the phone as much as they can and whatnot. You can book a time. And because it's social, it may take a little longer depending on what the issue is. But there's another thing that they have in Sweden, which I think is really cool in a way. I know I've talked to some other Americans and they don't think it's that cool, but I think it is. We have this number called 1177. You can call them. It's like Ask a Nurse. And basically you can call them and ask them anything before you call vårdcentralen. And you can ask them, should I call vårdcentralen? Should I call the hospital? What should I do? You can also go online and book times for your doctor as well instead of calling them. And you can also book times for blood work online too, which is really convenient. So say you have, you're not feeling well and you have a fever. You can call 1177 and you can tell them what your symptoms are, and you can ask them, should I call vårdcentralen? Should I go to the hospital? What should I do? And they'll tell you, because it's their nurses, yeah, maybe call vårdcentralen, or nay, give it a few more days. If you still don't feel better, then call vårdcentralen. So it's really kind of convenient. And it works the same way if you're pregnant and you're towards the end of your pregnancy and you're having contractions. You don't just go to the hospital. You call 1177 and you tell them, look, this is how I'm feeling. I'm having contractions. My water has not broken or has broken. And they'll tell you whether or not to go to the hospital or wait. Of course, if it's a life-threatening emergency, you go to the, you call, it's not 911, you call 112, and then, of course you do that. You don't just call a nurse. But if it's not life-threatening, then you call them and ask them what to do. So it's really convenient. So like I said, if you go to the hospital in Sweden, and you have a Person number, then it's, I think 200 crowns or 250 crowns, which is like $25 to go to the hospital. If you're just going to see your doctor. Like I go to vårdcentralen for like my therapist or something like that. But for my Crohn's doctor, he doesn't have an office. The office is in the hospital, so I go to the hospital. And if I have to go and see him or talk to him, then I register downstairs and I pay the 250 crowns or so, and it's like $25. And then I go and I see my doctor upstairs, and then I come back down and whatever. If I have to have blood work done, I don't pay for it. I just, now with Corona Teeter, you book a time online, and then you go in and you do your blood work, and then you leave. You don't have to register or anything. Because you've already registered online. When you have a child, and you have a per sure number, and that child is now a citizen in Sweden, they have a per sure number, they don't have to pay for any health care until, I believe they're 18 or 19 years old. I think it's 18. Could be longer. So therefore, you don't have to, you take them to the doctor, it's free. You go to the hospital, it's free. Of course, if you need medication for them, you pay for that. It is subsidized, just like for us too. It's cheaper because you're paying for it out of your taxes, so it's not nearly as much as you would pay, I think, in the United States. It might be they're relatively the same. I'm not sure. I don't know. See, I'm not taking any Crohn's medicine right now. So yeah. So prescriptions, you can also get on once you hit a cap, I think it's 1,500 crowns per year for prescriptions, then you don't pay anymore. And the same thing for the doctor. If you go to the doctor a lot during the year and you hit that cap, and you're still going to the doctor after you hit that cap, you don't have to pay for the doctor visits anymore. So that's kind of cool. I know there's some people that don't like it because I go to the doctor, or I went to the doctor a lot, so it worked out well for me. Other people who don't go to the doctor as much don't feel that they should be paying as high taxes as other people, but because it's social, they have to. So it's kind of like some people like it, some people don't like it. It just depends. I mean, if you go to the doctor a lot, it's great. If you don't go to the doctor so much, it kind of sucks because you're paying taxes and you're not using it. So therefore, I mean, there's good and there's bad in every system. So I've almost made this video 30 minutes. So that is my video on kind of like the US and the Swedish healthcare system. If you have any questions or comments, leave them below and I'll be happy to answer them. I hope it answers some of your questions. If not, ask me and I will do another video. I have no problem doing that. But thank you so much for listening to me. I hope you have a wonderful, wonderful rest of your day. It's raining here in Sweden. It's very, very tråkigt. It's very boring. It's late November, so yeah, but it's warm out, which is weird. I'm looking out the window, by the way, if you wonder where I'm looking. And I hope it stops raining when I have to go pick up my son from school, because I walk. If not, we get rained on. Oh well. But anyways, have a wonderful, wonderful rest of your day, and I will see you again soon. Hello.